Human metapneumovirus, or hmpv, is a very common virus. It infects people of all ages. hmpv is a respiratory virus, which means it affects the nose, throat and lungs. Most people get hmpv before they turn 5 years old. hmpv is a lot like the common cold. It spreads easily from person to person. When someone with hmpv coughs or sneezes, tiny droplets containing the virus go into the air. Other people can breathe in these droplets and get infected. You can also get hmpv by touching surfaces that have the virus on them and then touching your eyes, nose or mouth. hmpv is most common in the winter and early spring. This is the same time of year when we see a lot of colds and flu. Most people who get hmpv have mild symptoms and get better on their own. However, hmpv can sometimes cause more serious problems. This is more likely in young children, older adults, and people with weakened immune systems. These groups are more vulnerable to complications from respiratory infections. hmpv symptoms are very similar to those of a cold. This can make it hard to tell the difference between the two. The most common symptom of hmpv is a cough. Other symptoms include a runny nose, stuffy nose, sore throat, fever, and wheezing. In some cases, hmpv can lead to more serious illnesses like bronchiolitis, pneumonia, or ear infections. Bronchiolitis is an infection of the small airways in the lungs. It can make it hard to breathe. Pneumonia is an infection of the lungs. It can cause a high fever, cough, and difficulty breathing. Doctors usually diagnose hmpv based on a person's symptoms and physical exam. The doctor will ask about the patient's symptoms and medical history. They will also listen to the patient's lungs with a stethoscope. In some cases, the doctor may order a test to confirm the diagnosis. This is usually a nasal swab, where a small swab is used to collect a sample from inside the nose. There is no specific treatment for hmpv. Just like with a cold, the best thing you can do is rest and drink plenty of fluids. You can also take over-the-counter medications to relieve your symptoms. For example, you can take acetaminophen or ibuprofen for fever and pain. You can also use a saline nasal spray to help relieve a stuffy nose. In most cases, people with hmpv recover completely within a week or two. However, some people may develop complications such as pneumonia or bronchiolitis. These complications are more common in young children, older adults, and people with weakened immune systems. There are several things you can do to help prevent the spread of hmpv. These are the same things you do to prevent the spread of other respiratory viruses, like the cold and flu. First, wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Second, avoid close contact with people who are sick. This includes shaking hands, hugging, and kissing. Third, cover your mouth and nose with a tissue when you cough or sneeze. If you don't have a tissue, cough or sneeze into your elbow. Finally, clean and disinfect frequently touched surfaces such as doorknobs, light switches, and phones.